So the most common side effects, of course, are sore arm, right, in the site of where the vaccine went in, and some fever. Sometimes people are fatigued, particularly if they're getting their second dose. They feel like they want to sleep off the next day. Symptoms are really over within a day and a half or 2 days from the vaccine. If people are getting symptoms beyond that, then they should look for other causes because generally speaking, they're done in a couple days and they're mostly mild. We've not seen severe side effects or any severe outcomes from the vaccine.
Now, there's some question about whether or not the vaccines will ever mix. If the first dose is Pfizer and then you go to Moderna, to your knowledge, has that happened? Or if it does, is it okay?
For the most part, we're trying not to do that because the clinical trials are all based on testing 2 doses of a specific vaccine. That said, there are people now doing clinical trials to see if you can cross the vaccines, but really would not recommend it. And we're really waiting for the clinical trial data to see if they work well.
The system seems to be running pretty efficiently when it comes to scheduling that second dose. What's the time frame that someone could actually elapse where, they may not get it that exact day, but perhaps the week or two following?
Right. Yeah. Technically, you can go up to 42 days after the first dose before you get the second dose. There have not been any studies beyond that. So, we try to encourage people to get that second dose as close to the scheduled time as possible, mostly because that's how the clinical trials were run and that's what we know about. But, really, there is some window there for up to 42 days.
Now, there seems to be some confusion with whether or not you've already had COVID-19 and then you have the option to get the vaccine. What is your recommendation?
Right. Ultimately, we all believe that it'd be best if everybody were vaccinated, including those people who've had the virus. Now, it is certainly true that there's good evidence to show that people who've had the virus, particularly symptomatic virus, if you've had no symptoms or very mild symptoms, that's not as clear. But people who had, pretty symptomatic disease, not necessarily hospitalization, but they felt lousy, those folks generally generate their own antibodies. They generate their own immune response, and they're probably protected. So, uh, from the perspective of just letting other people go first, it could make sense for them to wait. They probably don't need it as much as those people who've never been vaccinated and never gotten the illness. But eventually, we do want everyone to get vaccinated.
What is the research telling you about whether or not this particular vaccine will last for the duration of this virus, or are we going to be doing this again in the fall like we do with the flu vaccine?
Well, we don't really know yet, of course, because it's not been that long. We don't think that this virus is like the flu virus. The flu virus is a very clever virus that is constantly changing its disguise. And so every year it comes back looking a little different from the year before. And we have to update the vaccines every year to kind of keep up with all of its changed, how it changes its appearance. That does not appear to be the case with coronavirus. Coronavirus is not so clever. It looks the same all the time. And so we probably won't need to kind of re-up vaccines every year. We just don't know how long it will last. We do believe that it appears that these vaccines are doing a great job at preventing severe illness, and that by far is the most important thing.
Any indication that this vaccine prevents against this variant of the virus that seems to be emerging?
Yes, so there are a number of viruses, number of variants that are emerging. There's the UK strain, and then there's one from South Africa called B1351, and then there's also a strain out of Brazil called P1. And what we know is that although the vaccines are a little bit less effective against infection from those viruses, it still provides very good protection. At least the Pfizer vaccine and the J&J vaccine, which have both been tested, it still protects against severe infection. So even in areas where those variants are endemic, not seeing hospitalizations, not seeing deaths when people are vaccinated. And so the vaccines are still pretty effective even against those variants.
Dr. Fauci raised some eyebrows recently when he said that he wasn't sure if this particular vaccine prevented an illness against people who might be asymptomatic, because there is question, should you keep wearing your mask if you've already gotten both vaccine doses?
In the state of Arizona, somewhere between 70 and 80% of our population has still not been infected or seen the virus yet. So there's a lot of people out there who could still get infected, and some fraction of those could get very ill. So while we're still trying to get everybody vaccinated, we should still be wearing masks and still following the guidelines. Even those people who've been vaccinated, when they are around other people who have not been vaccinated, should probably wear masks and protect themselves. Now, people who are vaccinated with other people who've been vaccinated can mingle freely and without masks, and they should be able to do whatever they want to do. It's really just when people who've been vaccinated are around people who've not yet been vaccinated, they should probably still wear masks, at least until we get everybody vaccinated.
Okay, Dr. Joshua LaBaer from Arizona State University. Thank you.
Thanks.